Turning our attention now to important health news, the CDC says this flu season is one of the worst in more than a decade. We hear how the very young and the very old are often most at risk, but pregnant women and their unborn children are also vulnerable, especially vulnerable to the flu. So Dr. Jessica Shepard is an OB/GYN with Baylor Scott & White and joining us now. So let's compare here for a moment. You've got a healthy woman who's not pregnant versus a healthy woman who is pregnant. She's more susceptible. Why?
Completely. I'm so glad that we're discussing this because in pregnancy there are so many things that happen in the body, whether it's with the pulmonary system, the cardiovascular system, so many changes that are going to decrease, one, your susceptibility to be able to push off that virus and really thwart away any illnesses. And also, you have more chances of becoming even more sick because you have these decreased immune response.
So already you're compromised and then this virus invades your body. Is it possible if a pregnant woman has the flu, does the child in effect have the flu as well?
So there is a chance, not necessarily that the child has the flu, but the complications that occur for the mom can definitely affect baby. Now there have been instances where they have seen very rarely some maybe neural tube defects with babies that have mom that do have the flu in a severe form, but when mom is compromised, baby's compromised.
So if there's a woman who's pregnant who believes what some people believe, that the shot itself might actually do more harm and they decide to forfeit the shot for a year, you're saying that's absolutely not the path to take.
Absolutely not true. You know, the flu vaccine has been around for so long. What we do know is that the flu vaccine is inactivated. What we do recommend as an OB/GYN is not to get the nasal spray in pregnancy because that is a live virus that's in the nasal spray. So we want you to get that inactivated
Oh, there is a
flu.
distinction between the shot and the spray.
Absolutely. So in pregnancy, do not get that nasal spray, get that shot. It's inactivated. It will not compromise you. It will protect you and your baby.
Well, regardless if you're pregnant or not pregnant, the effectiveness of this shot, which is not to allow that to be a reason not to get it, but the effectiveness of it this year has been especially low.
Yeah.
It's like nothing you've ever seen.
Yeah, so this is a different virus. Again, we know the researchers go out and look ahead of time at what exactly flu virus they're affecting. So H1N1 was maybe what they anticipated, but now it's H3N2, which is really affecting everyone this year. We've had 63 pediatric deaths in this flu season. That is horrible.
And some counties don't have to report flu deaths, and so that number could be higher.
That number could be higher as well.
So sepsis, that's the turning point when someone is experiencing complications from the flu, and sepsis can develop more quickly in pregnant women as well.
Absolutely. Again, that immune compromise or that immune system is not able to push away that virus. You will see someone who's very healthy one day, especially in pregnancy, and that next day they are so sick. Sepsis comes down and their basically body is shutting down, so they're not able to help baby. That is the main job of mom, is to support baby.
All right, in so many cases, even before the season has peaked, so again, stressing the importance of getting that shot, Dr.
And taking Tamiflu.
Even as a preemptive measure.
Absolutely. If you feel symptoms of dizziness, of fever, chest pain, go to your doctor, get some Tamiflu, absolutely take that.
All right, great advice, Dr. Jessica Shepard with Baylor Scott & White. We appreciate you for joining us here this midday.